Hello, I'm Harold Jones, Dean of the School of Health Professions at the University of Alabama at Birmingham. Thanks for joining us for another discussion in our continuing monthly series where we interview experts in our school. These experts are leaders helping to shape the future of healthcare through tailoring innovative solutions to real-world problems. Joining us today is Dr. Paige Powell, an assistant professor in healthcare management in our Department of Health Services Administration. Paige is also a policy analyst and has spent the last few years researching the Patient Protection and Affordable Care Act of 2010. The U.S. Supreme Court recently heard arguments to the health care reform bill, and it expects to make a decision this summer. This landmark ruling will have an effect on each one of us. Paige, thank you for joining us today.
Thank you for having me.
What were some of the drivers behind the passage of the Affordable Health Care Act?
Well, for decades now, we've had problems with quality, cost, and access. We have about 50 million people uninsured in the United States now. About 40 million of those are actual citizens. We spent $2.6 trillion on health care in 2010. 18% of our gross domestic product, which means 18 cents out of every dollar, goes to health care in the United States. And we have about $13 to $18 billion that we have attributed to medical errors every year in the United States. So those are tremendous problems that we need to find solutions for.
The Affordable Care Act is a very complicated piece of legislation, very large. What are some of the key provisions in the act?
Well, it's an act that has essentially 9 titles to it. Insurance reform is a major component. There are some reforms to Medicare. Medicaid Expansion is another part, as well as some payment reforms, quality improvement, and there are a few parts of the act that were passed that have been determined to be unworkable that aren't actually going to be enacted. The main parts right now under contention are the insurance mandate and the Medicaid expansions.
Could you tell me a little bit more about the pieces of the legislation that are particularly contentious?
The insurance mandate was designed to provide everyone who is a citizen in the United States with insurance coverage. And the way that insurance works in the United States now is that we have a patchwork of a number of people who get insurance through their employer, the elderly who get insurance through Medicare, poorer people who get insurance through Medicaid, and then others who are left to buy insurance in the individual market. So people who buy insurance in the individual market tend to be sicker and have to pay much higher premiums as a result. Also, there's a number of people who can't get insurance in the individual market because they have what's called pre-existing conditions. They've been sick before, and so insurance won't offer them coverage. And so for people like that, what the Affordable Care Act does is it puts limits on, essentially doesn't allow insurance to turn people away because of pre-existing conditions, and also it allows for what they call community rating, where basically everybody pays about the same premium, and it also doesn't allow insurance to turn anyone away. Well, in order to have those provisions and to be affordable, then you have to have everybody purchase insurance. You have to have healthy people buy insurance to sort of subsidize the sicker people, and that brings the premiums down. And so that's the goal of the individual mandate, and that's the point that's under contention right now. Opponents of the legislation don't think that people should be made to purchase a product. And the option of if you don't purchase the product, you have to pay a penalty. And that's what's being argued in the Supreme Court right now.
The Supreme Court also heard about the constitutionality of Medicaid expansion. What would be the impact of that expansion on states, and particularly Alabama?
Well, there's actually 2 impacts on Medicaid that the states are arguing about. The first is that the individual mandate is going to impact states for the number of people who are already eligible for Medicaid but aren't participating. And those people are going to sign up for Medicaid when the individual mandate comes into play rather than paying the penalty. So that's an unfunded mandate that states are going to be obligated to pay. In Alabama, that's only about 100,000 people, so that probably won't affect us as much as it will some other states. Florida's expecting like 500 to 600,000 people that are eligible for Medicaid but aren't actually enrolled. However, Medicaid expansion under the law, for that the government is planning to pay 100% for the first 2 years, and then it's going to slide, I think 97% for 2 years, 95%, until eventually, as of 2020, they'll pay 90% of the cost just for the new people. And so the older people, the people, I don't mean age-wise, but the people who are already on Medicaid, right now, the federal government pays about 68% of their costs in Alabama. And that changes every year, and it varies based on the state's income. Poorer states get a larger share paid by the federal government than wealthier states do. And Alabama is relatively a poorer state and tends to get a larger portion of federal Medicaid dollars. So we're talking about $4 billion for the state of Alabama. We spend about $6 billion on Medicaid. And the option is, if you don't agree to the expansion, then the federal government can take all of your Medicaid funding, that $4 billion away from you, which leaves you essentially with nothing to provide care for the poor. At the same time, though, our budget is already stretched, and our Medicaid program is already having trouble providing care for the people that are on Medicaid. So now you're talking about adding 100,000 people who don't have Medicaid coverage but are eligible now, and another 500,000 people or 600,000 people who will be newly eligible under this plan, that we're still going to be obligated to pay eventually 10% of their cost. So the state's going to have to come up with that money from somewhere. And the states see this as another unfunded mandate or another obligation that is coercive on the part of the federal government, and are then asking it to be overturned in that respect. So in the past, the federal government, the Supreme Court has said at some point federal government can get too coercive in its demands on the states, but it hasn't ever reached that point. So the states are arguing it's at that point now, and we'll just see what the Supreme Court decides.
When you look at the Affordable Care Act, what are some aspects of the act that you think almost everyone would view as being positive?
Well, I really like the emphasis on quality in the act. I think that one of the things that they're trying to do is reform both the cost and the quality system, and to link paying for care with paying for quality. A lot of things that we do right now, we pay for volume, and that encourages doctors to do more. And it also doesn't necessarily encourage people to provide better care. But with things like value-based purchasing, that's where you'll get paid bonuses based on certain quality metrics. And there's other types of incentives within the system for Medicare Advantage and other mechanisms to try and encourage improvements in quality. There are also penalties for things like hospital-acquired infections and other types of conditions. And so we're really trying to move towards paying for quality. And I think that that is really where the future of healthcare payment needs to go.
Although the constitutionality of the act should be decided this summer by the Supreme Court, it's also possible, isn't it, that legislative action in the fall could make a difference in the implementation of the act. Could you tell us a little bit about how that might work?
Well, it really depends on how the power structure changes with the election. So, for example, if President Obama wasn't reelected and a Republican were to take control of the White House, as well as the Senate changing hands, then there might be a chance of a repeal of the legislation. However, I think that that's a very distant possibility because chances are there wouldn't be enough votes in the Senate. However, if Republicans have control of especially both the House and the Senate, even if they don't take control of the White House, then what could happen is there's a lot of portions of the bill that wouldn't get funded. And those are actually called rescissions, where Congress decides at a later time that they're going to defund or to change funding on a program that's already been passed. And so essentially when that happens, the program doesn't exist. It's still on the books, but it doesn't get any funding, so it doesn't go into play. However, if President Obama remains in office, if the Democrats take back control of the House, retain control of the Senate, and also if the Supreme Court upholds the law, of course, then we'll see the implementation of the Act continue as it's written.
Paige, once again, thank you for joining us today.
Thank you for inviting me.
If you have any questions or comments about this topic, please feel free to contact us at uab.edu/shp/contact. And while you're on our website, be sure to learn more about our school. Once again, thank you for joining us. I'm Harold Jones, Dean of the UAB School of Health Professions, where we're shaping the future of healthcare through tailoring innovative solutions to real-world problems.